with the wrist and or the ankle, you want to apply multiple elements of distraction. And usually when I do these mobilizations, I anchor on the table and you see me in the treatment room like this. All right, take a nice breath in and out. So usually the dysfunction that I encounter requires a distraction, loading in through the distal radial ulnar joint, and with extension, there's usually a click. You okay? You sure? Okay. You might have to do it a few times, a distraction with extension, and release the distraction before you release the mobilization. You okay, Min? It feels weird, right? When you grab the wrist. And then when you're done with the mobilization, you compare. Almost there. Good, let it go, let it go, let it go. Okay. You sure? Yes. You're not acting like it.
Yeah, show it to me.
Yes, lots of clicking. So we will do that with Because keep in mind, you guys are going to have other people also like doing these corrections, right? Good question. So when I'm assessing to determine that this actually needs to be done, I'm always comparing it to the side that doesn't give them grief. And it's less prominent in yours. So there is a variance. It's actually in the radius versus the rest of the wrist, but often I'm feeling for how the tissues feel over top of the hinge. Now often there should feel like a little bit of a gap, a little bit of a space between the hand and the wrist, or the forearm portion of the wrist, but often it'll feel quite flush. Flush, like there's no real gap, like it feels like it's filled with tissues. Not full bent, but if you're in this position here, like for you, this one is more flush than this one here. There's more of a gap here. This one feels like more tissue.
And you're doing flash slide?
Yes, the one that's flush, we want to try and create space. So we want to try to encourage that gap. Nice breath in.
So this one is overload.
You okay, Jane?
What does the more space indicate again, Ali?
Say what?
When there's a bit more space in one than the other, what was that kind of indicator?
Oh, just the closed congruency. So it just means that there is a lack of space.
Gotcha.
Yeah, so we're trying to encourage space. You okay, Jean? You sure?
Encourage space.
Are you lying? Girl.
Yeah,
She didn't say no.
She didn't have
So you're like,
If it's too intense for them, you can back off and do it in gentle oscillations as well too. You okay, Jade?
Yeah.
Okay.
Nice loss.
The reason why I need both thumbs is because there's two bolts, the radius and the ulna, and I'm trying to encourage movement of both.
extension.
You could if you were just targeting the one, but often it needs to be both.
You're separating ulna and radial?
No, I'm not separating them. I'm pushing them both backwards when I'm bringing the wrist into extension.
Oh yeah, I feel gap now. At first, there's no gap.
Next.
Yes.
Okay, two more. Okay, two more, and then we're doing exchange.
Can I go after Ashley, please?
Very nice try, Harold.
It's actually way better.
Yep. It's a little painful, but
It's better. 你看我本来这里没有 gap 的。
这怎么知道的呀？
don't crush your knuckles together, my friend. If you're gonna crack them, pull them apart.
Oh, okay. Is that bad for you?
Well, what do we call it when it's bone-on-bone articulation happening in the joint?
Ooh, close back body.
And arthritis.
Stop.
Oh my god. Okay.
I think she caught it.
Snap.
Snap.
Good. It probably won't snap again.